Welcome, everyone. Today is October 3rd, 2023. First day that I've actually had to have my house's heater on. A little bit of a hoodie weather here, sweater weather, which is really nice. Fun to see that coming along. Welcome to October, everyone. I believe you have 11 weeks until Christmas, something like that. So get those plans ready. This year has gone by like nothing. So yeah, super fun, spooky month. But today, what we are going to be talking about is the universally unique identifier. We are ecstatic to have the principal investigator, Mann, with us today, who is going to be taking us through this webinar. We're going to talk about how the UUID is used to link EMS and trauma registry records at the state and national levels. And it's an exciting topic for us. We're looking for feedback from you about promoting this to the people who can use it so they understand the power of it and what they can do with it. So without any further ado, also this meeting is being recorded. Always want to let everybody know that when you're participating here, it is being recorded. If you have a question, please raise your hand, indicate in the chat. We will unmute you so that you can ask your question. We love these to be conversations, but we just have to be a little bit cautious because we have been interrupted by Zoom bombers in the past. So we are just being a little bit more cautious now by allowing people to having them indicate that they have a question, then unmuting. So I think that's all the housekeeping. Clay, thank you very much for being patient while I remember everything. I'll turn the time over to you.
All right. Thank you, Chris. I appreciate it very much. And welcome everyone for joining us. Glad to have you here today. Yeah, I would love this to be interactive. If you have any questions, please raise your hand or use the chat. Would love to be able to answer those questions as we go through the presentation. All right, so yeah, we're going to be talking today about the use of a universal unique ID that is present in the latest version of NEMSIS, version 3.5. That really perhaps will serve an incredible value for us in being able to link together EMS data with trauma registries. So looking forward to talking about that. Wanted to ask a quick question, though, of the group. Looks like we have over 40 people that are joining us, which is great. Thank you so much for joining. If you could take a moment in the chat and maybe just indicate whether you are affiliated with the EMS industry or if you are affiliated with the hospital industry, particularly trauma registries within hospitals. It would just be great to know what kind of a mix we have here in regards to this linkage, right? The two sides, the EMS side or the trauma registry side, just to make sure that we're answering the questions that would be appropriate to either of those two groups. Yeah, so thank you for responding. 12 responses so far. Thank you, 14. Oh, great. Great information. Fantastic. Wow, we do have a really good mix of folks. Oh, great. Fantastic. Great. All right. Well, let's dig in a little bit. It looks like everybody else can also see the great diversity we have in this group. Yeah, so let's begin talking about the NEMSIS UUID. So I'll talk a little bit about NEMSIS just based on what I'm seeing here in regards to folks. I'll talk a little bit about NEMSIS just to help folks understand that it is truly an information system, right? NEMSIS stands for the National EMS Information System, and that system allows the use of this UUID to help us with trauma registry linkage, and we'll talk about that. But that system is important to understand, and we'll talk about that, the application to trauma registries, and then maybe some upcoming initiatives that I want to make sure that you're aware of that will make the point that we are needing to develop and mature this relationship between NEMSIS and the American College of Surgeons a standard, the NTDS, the National Trauma Data Standard that's used by TQIP and other groups. These initiatives, I think, are going to help with that. It'll be important for you to know that those are coming out. And then most importantly, we need to hear from you in regards to what additional resources we can make available that will help you to better integrate and utilize this UUID to bring together records at the state and national level. So we'll talk about that in a minute. I'll mention that there was a previous monthly training that NEMSIS offered about a year ago that was done by Josh Legler. He did an excellent job talking about the technical aspects of the NEMSIS UUID, understanding it completely in regards to EMS records. And I've provided a QR code here for you if you want to view that presentation. That goes into great detail in regards to the use of an international standard to develop this UUID, the RFC 4122 standard. So lots of detail there that could help you if you want kind of a technical review of how it's implemented within NEMSIS. But let's talk a little bit about what NEMSIS is, just very quickly, just a couple quick minutes here, and talking about it as an information system. So NEMSIS really was an effort that was initiated in the early 2000s to really standardize EMS data across the entire industry. So it really provided a way to collect patient care information in the pre-hospital setting in a very standardized way that is exactly standardized across the entire country. We provide a mechanism for cleaning that data. Over 400 business rules at the time of data entry help to make sure the data is clean. We provide mechanisms for storage of the data. It's important to recognize that when an EMS record is closed anywhere in this country, when they go to share that data, when they go to press the button to have it travel, it first goes to a state repository, right? So every state has the same data that is available nationally in the national repository, because we just get a subset of the data that is sent to the state, right? So there's complete data at the state, and we have a nice subset at the national level. One of the two incredible kind of attributes of the NEMSIS standard is that it is ubiquitous, right? It really provides close to a complete census as you will ever experience, right? Where we actually have every record, all 52 states and or 51 states counting the District of Columbia, and 3 territories submit data to NEMSIS on a daily basis. We collect about 53 million EMS activations across the country. There's really only one county in the entire country that is of note that isn't submitting to NEMSIS, and that's LA County, but we're working on bringing them on hopefully in the fall. So the fact that it's so ubiquitous, that all of the data is collected at the states and at the national level, make it incredibly valuable in regards to trauma registries, in that we have an electronic copy of that pre-hospital care offered to that trauma victim in state repositories and national repositories. How do we make it available to you at the hospitals, to researchers who want to improve our ability to care for traumatically injured patients? Well, this is a map of the states and territories that are utilizing the NEMSIS 3.4 standard, version 3.4. We're going to a standard called 3.5. There's not much difference between 3.4 and 3.5. One of the important additions is the inclusion of the NEMSIS UUID. So having that value within that software is what brings us together to here today and allows us to talk about this. This gives you an idea of how many states now at the state level make use of the NEMSIS UUID, and which states are working towards getting there. We really have commitments among all the states to move to version 3.5 by the end of this year. It looks like there's a lot of states that still need to move over. Lots are very close to making the transition to 3.5, and maybe there might be a couple of stragglers into the year of 2024, but we should have most states on. So it's incredibly important that we have the opportunity to talk about this now, because it truly is rolling out in every state. So maybe it is important to understand the system a little bit, right? So these 53 million EMS activations, they're traveling, they're interoperable, right? They're moving to state repositories into the national database. So if you look at this schema, it kind of makes it clear, right, that there's patient care reports are to be completed, and here's three agencies, A, B, and C. As they complete that record on that patient and they press send, that patient care report goes to the state repository, a state database, and then there's a subset that comes to the national database. So those records reside in both. Uh, it's quick, right? I'll share with you if we're just doing a tabletop experiment, right? And I'm talking to a paramedic in a living room in Fargo, North Dakota, and I say press the button to send the data. By the time that data gets to the state repository in North Dakota, and then that state repository sends it on to the national database, that process, it takes about 7 minutes. Now, data is a little bit slower than that, right? Because there's a lot of reasons why an EMS provider may want to hold on to a record before sending it, right? They're trying to get as much data as they can in. If they've got an unconscious patient, they don't know their name or address of the patient yet, they may hold off. We try to express to the providers across the country that even if you don't have the data complete, go ahead and send it in, press send, and there's always an opportunity for you to update that record. It will move through that process that I just talked about in a wipe and load type of system. So it'll wipe out the old record and allow the new record to come in to take its place as you're adding data. Now, that's what the UUID does, and we'll talk about it in just a minute. But I wanted to share with you a screenshot that I pulled at the end of last week off the NEMSIS database. It just talks about the number of records that we're receiving at the national level, right? So we have about 10 days here. It's about 2.2 million records. So lots of records are coming in every day. But there's a blue box at the bottom of that page, the bottom left. That's what I want to just draw your eyes to for just a minute. So this just tells us how long it took for that record to be submitted from the date that it was initiated, right? The date and time it was initiated. And so you can see that really we have about 25% of the records within about 18 hours of that record being initiated, right? Them opening up a new record. What's phenomenal here, right, is if you look through this, really we're receiving about 75 to 80% of all records that occur across the country in about 3 days. So it is an incredibly timely registry of pre-hospital care for this country. It's almost a surveillance system, right, where you can look at utilize pre-hospital data to look at a variety of things. This really happened with COVID, right? So before COVID, these lag times would look like we'd have about 80% of the data in about 3 weeks, right? Just people were not closing their records with any urgency. I think the pandemic really incentivized providers and states to speed up the rate with which the data was submitted so that it could be available for surveillance purposes. And so it's just incredible what's happened. And that truly has been augmented by the addition of the UUID. So before NEMSIS added a universally unique identifier to version 3.5, when a record was resubmitted to the state, right, the provider now has some additional information. They want to send that record again. It's more complete. There was a cumbersome system to make sure that that record would be correctly identified with the existing record in the state database and in the national database, and would replace it. It was a clunky system. So the UUID provides a more clear, precise, deterministic, unique measure of record uniqueness to know exactly what record this incoming record should replace. So let's talk a little bit about what a UUID is. How does it happen? How is it included in a record? As I mentioned, UUID stands for Universally Unique Identifier. They were first created by Microsoft and called a GUID. a globally unique identifier. So a GUID and a UUID are basically the same thing. It is a value that you can see here at the bottom left that is generated by the software and independently within the software. So it's a program. Think of it as a random number generator within every application of the software. So there isn't a central location that is sending UUIDs across the country to ensure that they're always unique, right? Kind of the opposite is true, right? They're generated within every application of the software, and the complexity of the number ensures that it is unique, even though they're being generated by independent generators in every application of the data, right? So you can see here the idea that these independent random number generators would ever generate the exact same UUID is infinitesimally small, right? 2 to the negative 122 power, right? I mean, it's you're much more likely to win Powerball, right? To get the Powerball jackpot than to ever see 2 GUIDs or UUIDs that are generated and are exactly the same. So that provides incredible power. The other value is that it's a number that is assigned to a record that has absolutely no relationship to the patient or to the provider or to the receiving facility. There's no PII, there's no PHI here, there's no unique identification of anything other than the record. So you can imagine that really helps EMS when they're resubmitting multiple versions of this patient care report as they get more information, making sure that we have timely surveillance data at the state and national level, that just utilizing this UUID to determine what is the right record to replace in the state repository and in the national repository, a deterministic linkage process. The UUID makes that very, very simple, much more linear and much more accurate. So that's really the purpose within NEMSIS. There's many UUIDs within NEMSIS. A record for a vehicle or a record for an EMS personnel in the demographic section of NEMSIS all have UUIDs associated with them. We're talking about the UUID that's associated with the patient care report for the purposes of our presentation today. Well, so that's its primary purpose. How does it provide additional value in regards to linking EMS records to trauma registry records? So when we were developing this, we were working with the National Association of EMS Officials and the American College of Surgeons, who maintain the National Trauma Data Standard. And it was kind of recognized among that group that, hey, there's an opportunity here maybe to utilize the NEMSIS UUID to link together the whole EMS record with the entire trauma registry record completed in hospitals, removing the additional burden for trauma registrars to collect that pre-hospital data, and ensuring that all the data in the pre-hospitals environment and all of the hospital data collected in the trauma registries are available for researchers, right? Not just a small subset. So let's talk about how that potentially works and how it's rolling out across the country right now. And I'd love to hear from folks that perhaps are seeing this work or others that are waiting for it to come to fruition. But the idea is that if there is this UUID that sits in the background of the pre-hospital record, and a trauma registrar is sitting in the hospital, they have a patient that's been there for 3 days, it's now time to begin their trauma registry record, they pull the medical record to date, they have access to a state repository or a vendor repository of the EMS calls in their area. If they identify that they are the same, or there are 2 records for the same patient, they can connect them and have that UUID travel over into the trauma registry record. So let's kind of walk through a little kind of an illustration of how this is proposed to work and how it is working in some areas now, and hopefully rolling out over this next year across the country. So as we described, a patient, let's say Joan White is injured in a motor vehicle crash on the corner of State and Main. EMS arrives, provides a patient care report for that patient, delivers them to the hospital. The patient's been in the hospital for a couple of days now. The trauma registrar is going to begin the trauma registry record. If that registrar has access to the hospital record that's been completed so far, and also has access to an electronic list of through state software of EMS occurrences in their area, or a vendor product that shows EMS occurrences in their area, and they notice here's the same Miss White that was injured 3 days ago in a motor vehicle crash on the corner of State and Main. This is the same patient in both records. I'm going to associate that data together, and that UUID would automatically flow over into the trauma registry record. So it's kind of under the hood. This isn't something for the registrar to try to duplicate or to cut and paste. This will exist behind the scenes in the software as these two records are brought together. And so we'll talk about how that's actually working and where it's working in just a moment. But the value of it, I just want to make clear right now. So now that very unique measure, the UUID, that number is present in both records as they travel up through state repositories and into the national repositories. And as is commonly the place, personal health information or personal identifying information, PHI or PII, is removed as that moves up the into the state and national registries. That UUID remains. And so it allows for a very direct way of linking data rather than relying on fuzzy logic or probabilistic linkage or other things that we utilize now that can be very cumbersome and not always accurate. So that's the power, that's the value of having that UUID travel up with the record. All right, so we've got a couple of quick questions. Are hospitals storing the UUID as a secondary identifier? Jeff asked that question. Yes, I hope so, right? So we've been working with the software packages both on the EMS side and on the trauma registry side. The bulk of those registries in regards to trauma are maintained by ESO and ImageTrend. We're ensuring that they have placeholders to save this identifier. Yeah, I would love that Epic and Cerner and those who are maintaining EHRs also save that identifier, because it can be incredibly valuable for linking in other ways, and we can talk about that. Steve asks, where will the UUID show on the EMS record? It will not show, right? That's the idea, Steve, is that this very complex alphanumeric code sits behind the scenes, and the identification is just made through PHI that would exist in both records. Now, some folks have requested to see it or make sure it's moved across. If that's valuable, then I think we need to talk to software vendors to ensure that that happens. Let's see, next question. So if a person who makes the decision and identifies that the same patient is in EMS in the hospital, what are the odds of errors of assigning and associating the wrong patients? So that's a great question. We feel like the probability of an error is less than with probabilistic linkage or linkage data in other ways, because we have a human that's actually doing the linkage with access to all of the PHI that is present in both records to make the determination that this is two records associated with the same patient. So we feel like record linkage will be much more accurate this way than relying on probabilistic statistics in two data sets that on purpose were not meant to be linked together, right? We wouldn't have to use probabilistic linkage if the state trauma registry and the state EMS record had social security number and full name and address, and we would be able to link them directly. But our laws commonly have us remove that data at the state level. And so now we're having to use a probabilistic statistical model to link together two records that were never meant to be brought together, which is just complex, right? So Steve, so how would the registrar know the UUID to link to TQIP? So the register doesn't need to know the UUID because hopefully it flows over automatically once that registrar has identified that these records are associated with the same patient. Sharon asked, if the registrar realizes they've made an error, is it possible to unlink the records? Yes. That is a design feature in the software. So, all right, I'll move forward just a little bit. If there's other questions, feel free to ask them. So in sum, what is a UUID not? What is the NEMSIS UUID not? Well, it's not a patient identifier, right? It's not unique to a patient. It doesn't include part of their social security number, part of their birth date. It's not a patient identifier. It's not an event identifier, right? You could have multiple people injured in that crash on state Main. Each of them will have their own record completed in the patient care report or in patient care reports. And so each of those records will have a unique identifier, not for the event. And is it a magical way of linking two records together? No, it's perhaps a magic way of identifying the records that are linked, but the actual linking, the adjective, who does the actual linking is a human, is a trauma registrar. So it's not the linking mechanism. It's the mechanism that allows, after the linkage is accomplished, which two records are associated with the same patient for a given event once the data reaches a state repository or a national repository. So it's clearly a record identifier. So let's talk quickly about what are some of the values. We've talked about them, right? So the value added with this approach is, kind of as we mentioned, there's no intrinsic relationship to a UUID to any attribute of the call or the patient or the provider. So no PHI, no PII needs to be exchanged or passed up to state repositories or to even national repositories to be able to link together those records, right? So it really, it removes many privacy concerns. It moves many security concerns contained in HIPAA and in other mechanisms to ensure our privacy. It protects against that. And then finally, the other one I'll just mention before I get back to questions is as we've talked about, it now becomes a universally true linkage of records that's done in exactly the same way, right? So what do I mean by that? So in the past, models are put together by statisticians to probabilistically link together independent records at the state level or at the national level. Not even possible at the national level because there's not enough PHI or PII or relationship between the records to make that happen. But probabilistic linkage is different every time you run it because it's based on the quality of the underlying data. If you're using a fuzzy logic model, the same thing is true. They can vary in their accuracy every time they're run. So providing this consistent way to ensure that there is a unique method to bring together two records for the same patient, same event is also adds to the consistency, the reliability, and the validity of the linkage process. Sundance answered question. He says, I got one more question. At the agency level, we would definitely like to link PCRs for the same patient. Can the registry linkage happen at different levels between agencies, hospital systems, and state regional EMS? That's a great question, Sundown. So the way that this initial process is discussed, right, is that this linkage is done at the hospital level. So the hospital has the linkage. They may not necessarily need it because they're able to house PHI and PAI or PII under HIPAA. But it's true, it becomes valuable at the state level and the national level. What about back at the agency level? For them to get the outcomes, right, that are associated with the patient stay. How valuable would it be for our providers to know what's the quality of care? What could I have done different after I see their condition after assessed in an emergency department? So that's incredibly valuable. This process we're hoping can be used at the state level, Sundown, to bring the outcome data back into the PCR within NEMSIS. NEMSIS has a section in it called e-outcomes where that data can come back into the PCR record for them to view at the agency level. So Sundown, we're hoping once this linkage is made, there's ways to call into the state registry or the state AIG or IHE, however they choose to keep together their hospital or health records to bring those outcomes back into the EMS record. So that's the hope. So that in a nutshell is really the value of this process. We've provided some resources to help you be able to explain this to other people, to your colleagues, or your other stakeholders, or there are other folks within your state or hospitals. There's a QR code to download a document called A Novel Approach to Data Linkage. It goes into great detail about, it's kind of the business side of this linkage, and it talks about, and actually I'll bring it up here. If you bring this up on the NEMSIS website, if you go to that QR code, it provides great detail about why this is so important. What's the background? What are the challenges associated with implementation? What are the benefits in regards to data privacy, data accessibility, data quality, and cost savings to a state in regards to the linkage process? So this will be a valuable document to be able to utilize within your states. And we've also provided on the NEMSIS website white papers that get into the technical implementation of the UUID. So we have a document that helps our trauma or our EMS software correctly implement the UUID within their software, and a document that talks about how technically the data would be exchanged between an EMS software and a trauma registry software. So we're working to make sure that these kind of technical pieces are maintained. But there's more work to be done, right? So perhaps I'll just ask the question now before we get into this piece. Are there people on the call who they know that that the UUID within the hospital, for example, is being moved from the EMS record over to the trauma registry record? Are there folks on the call who have software in place and are actually utilizing this process? I'll look to see if there's any comments. Okay. All right. It looks like perhaps there aren't any on the call. There's several places in Colorado, South Dakota that we talked to, and in some other states that have this up and running and it's working well. The software, there are places to hold the NEMSIS UUID within the trauma registry software that's being rolled out now. And of course, we ensure by testing all EMS software compliance that they have the ability to generate a UUID. But I do want to take just a quick moment and let you know that there are federal sources that are making progress in helping us be able to ensure that this ability to exchange like this becomes ubiquitous across the country. So there's the National Academy of Sciences has rolled out several research projects where we're going to be asking states if they wish to serve as a pilot, providing finances for the software to work through the process of implementing the relationship between the EMS state software and a hospital trauma registry software, allowing registrars to view the records in both data sets and bring them together in an efficient fashion. So that's underway. And then also within the Department of Transportation, there are bipartisan infrastructure law or the bill programs are being implemented to allow for funding to help with the implementation of this process within states. So I think this next year, within 2024, you're going to be seeing opportunities for you to participate in these pilots, to get this up and running within your states, to be kind of the front runners and making this work across the country. So I hope that you'll be looking to those, and you can always come to the NEMSIS website for updates on where we are with this process. So more to come there. What I was hoping to do was to save some time to talk about what are the next steps that we can take to help you be able to bring to fruition this process within your state. And before I do that, I'm going to answer a couple of questions. Look like Anne has brought up some thoughts here. I'll just read her thoughts. We do link between our own trauma and EMS registry, but I don't know about CRASH also. So the CRASH data set. So a different CRASH related processes and data sets that NHTSA maintains. Not sure if this is determined yet or if there are other considerations, but would the trauma registries at the hospital level need to be part of a state web-based trauma software system, as that would be in the link between the trauma EMS registry and the state trauma registry? Or would this UUID via a trauma register still be possible if the hospital level trauma registry is completely separate? They have their own license to send data to the state. So yeah, it would work either way, Anne, right? Because they're sending that final trauma registry record to your state, either independently or as part of a combined system within your state where they're just on a web-based program that you maintain in the state. Either way, you get that trauma registry record with the UUID after that determination has been made by the registrar that they're the same patient. So yeah. I'd love some comments about what if you've heard of this, if there's a lack of understanding within your hospital. I added one comment here that I was talking to a colleague this morning, and she was saying, hey, you guys, you've got to have better coordination with the American College of Surgeons and the NTDS to make sure that the messages that you're sending are the same and as much detail as what the ACS is sending out to registrars across the country. Are there other ideas like that? Are there other thoughts folks have as to what we can be doing to educate states, to ensure that they see that this is not a security concern? What are there things that we can be doing to make this more palatable within the system of care that you're working in?
Participants can unmute themselves at this point.
Any thoughts?
Hey,
Okay.
Hi, Ann.
Someone else can go ahead first. I was just going to say that I think with the ACS, the coordination with NTDB would also be really nice to have everything go at the same time. So if they cut something out and they need it from us, you know, the examples, that we all kind of are on the same page in the same timeline.
Great, thank you. There was someone else who had a comment?
Yeah, Clay, it's Steve Cohen from New Jersey, from RWJ Barnabas. Our trauma registrars and trauma centers have been asking for this for a while. And at least the way they explained it to us, what they were thinking was that they do receive all of our EMS records, that there would be some way from the EMS record for them to input the UUID or something else into the trauma registry that would pull our data into it.
Yeah, Steve, it's a great question. And there was some confusion that was even distributed between us and the ACS early on about the UUID placeholder with NTDS be viewable, be visible. It was an element within the data dictionary, so it looked very much like an element that they needed to complete. So yeah, Steve, the idea is to not add complexity to our registrar's job by trying to cut and paste or copy that very complex alphanumeric number over into the trauma registry. Just have that flow over as they identify the EMS record associated with the patient. Steve, registrars are used to seeing data, right? When they're told there's data that needs to be in the record, they're used to seeing it and inputting it, right? Making that exchange. So we've had folks say, hey, even though it's going to go over, it'll move over automatically, like you talked about. We'd still like to be able to view it or see it or make sure it went across. So I know there was some confusion there, Steve, and I'm not sure if it adds true value to have them see it, but we can certainly talk to the vendors about making sure that there's some indication that it's moved or that they can see it in the trauma registry record to make sure that they feel like the record's complete. Would that be helpful?
So yeah, what they were thinking was it was going to make their life easier. So if they were able to identify that, pop it into the registry, and the registry would essentially pull in all of the information that they're now manually inputting.
Right. That's right. There's actually 33 elements that were in NTDS that were related to the EMS record, right? So it saves them on every single record, abstracting 33 elements. Yeah. So so the value is there right now. Now, as folks know, the NTDB removed all EMS data points from the trauma registry record, which was probably a little too preemptive because of COVID. NEMSIS version 3.5 didn't roll it as quickly as we anticipated, but now it's here, and it really should save the registrars a fair amount of work by not having to abstract that record.
Great, thank you.
Yeah, thank you, Steve. So Josh from Biospatial, regardless, the trauma registrar needs access to a system that can access the EMS record and link the EMS record to the registry record. NEMSIS has emphasized that the UUID is not something to be manually copied or even viewed by the registrar. This currently lends implementations to be tied to a single vendor. So that's true. That's exactly right, Josh. And that's what we hope, right? Is that it really is something that doesn't need to be viewed. I'd really love it to just be something that sits in the background and our registrars don't have to even think about, right? They just know that, hey, I've got 33 less elements I need to abstract. And at the state level and the national level, all of the EMS data will be available to hospitals, and EMS will have all the information related to the hospital available to the EMS record. So let's hope that it moves forward in that way. Douglas from Kentucky says, any plans to implement UUID into PSAPs? Yeah, what a great question, right? If we could have this UUID collect to our public safety answering points, our 911 data, that would be fantastic. And of course, Douglas, as you probably know, the complication we face there is that there's no standardization of PSAP software across the country. And so it makes it really difficult to do these one-off connections. So we continue to work with PSAPs with EMD systems, trying to help them see the value of working with us with a single standard. Great questions. Great questions. Okay, Chad from Kansas. Clay, how do we handle a patient initially ran by ground EMS and then flown to tertiary care? Both the ground and air records will generate two separate distinct UUIDs for the same patient. How is this handled for a trauma registry? And is there any discussion on the EMS side about how to prevent this from happening? So Chad, great question, right? There can be multiple patient care reports for a single patient before they reach tertiary care, final care. So it's a great question. So the trauma registry software has implemented the UUID placeholder as a one-to-many, meaning that many UUIDs, more than one UUID, can be added to that EMS record if the registrar has found multiple patient care reports that are associated with that patient and that event. So if the registrar is looking at these two systems, oh, and there's the ground transport for this a patient, and here's their ground transport to the staging area before they were flown, right? I've got those two patient care reports here. Once they associate it with that trauma registry record, both of those UUIDs can exist in there. All right. Yeah, you're welcome, Chad. Douglas, maybe next gen UUID could be initiated by the PSAP software and then push to fire. Oh yeah, wouldn't that be fantastic, right? If that UUID was to flow from the beginning of that at the onset of that event, right at the PSAPs, that would be amazing. That would be absolutely amazing, because all the records associated with that patient and that event could just be automatically associated by that UUID that would start at the beginning, as Douglas mentioned. That would actually be fantastic. Great questions. All right, would it be helpful to see a sample of one or more scenarios on what the data would look like? That's a great idea after the linkage is done. Yeah, maybe what we can do is build some use cases. Yeah, that's a really good idea. Maybe we could develop some use cases that would kind of be pictorial, right? That could help kind of illustrate what it would look like for multiple transports for the same patient across, like a stabilizing hospital and then to tertiary care, and having multiple ambulance transports and also multiple hospital stays, and making sure that it's clear how that will happen within the software. Yeah, that's a great idea. That's a great idea. We'll work on some use cases to share. Great idea. Any other thoughts or questions? Okay, Josh, as PSAP could generate an incident ID that was implemented as a UUID, but that is distinct from a patient event identifier. there may be multiple patients in an event and also distinct from the current NEMSIS record UUID. That's true, Josh. That's exactly how that could work, right? I think the event identifiers are still going to be important, and the patient identifiers are still going to be important, but the record identifier could be implemented from the PSAP as a separate UUID. Yep. That's a great idea. I'm hoping that isn't pie in the sky. I'd love to see that happen because that would solve a lot of issues for many people. What variables or criteria will the person who does the linkage be using? Thank you so much. I think you said the same variables as when we do the linkage. Yeah, that's right. That's right. The variables or the patient information that's available in the EMS record or the hospital record, that won't change. And that will be used for that actual person to identify those same records. Yep.
Hey, Clay, this is Josh Legler.
Oh, hi, Josh.
I just wanted to point out one thing too, that really what you've covered today is the standards setting side of things, where the NEMSIS standard, as a standard, it sets a foundation to make this integration possible with the UUID. And then there's the whole implementation side that is on the backs of EMS software vendors and trauma software vendors. That the standard makes this possible, but until people actually build software that implements what you've described, then it's not there yet. And so a lot of this work lies on the vendor's shoulders, where they'll be making these decisions with their customers about, well, what kind of UI do we show to our trauma registrar that shows them the patient's name and birth date and incident date, whatever things would help them to know that they're picking the right record. And it's on the vendors to be interoperable with each other, that data could be sent or could be queried between systems so that EMS data can make it over to a trauma registry system where it could be queried and imported. And decisions like how do we identify the first vital sign, the first systolic blood pressure on scene. There's some logic behind that. All of that is kind of outside of just the standard setting of having a UUID in the NEMSIS standard. So lots of work to be done on that side.
Yeah, thank you, Josh. And that's also valuable to remember. And I think Josh kind of speaks to that point as well, that they welcome the opportunity to work with their clients to understand how they see this system working right within their state or within their hospital systems. So there could be great value in you as a person reaching out to your current vendors and expressing your interest in better understanding how this will work. Yeah, thank you, Josh. Any other questions or thoughts? All right, great. This has been incredibly valuable. Thank you for your comments. And I think we've got some good notes as to perhaps some other resources we can make available that will clarify some of the more complicated scenarios that may occur and do occur in our pre-hospital setting as we attempt to care for patients as best we can. So we'll work on those. I think that will be helpful. And I really appreciate your comments and you're willing to join us for this hour. I think this is an incredible ancillary additional value of the NEMSIS UUID, and I very much looking forward to its implementation. As Josh mentioned, all of us working together and making sure that our vendors understand what our needs are and how best for us to understand it. We'll work from the NEMSIS side and standards side to provide as much support as we can to them as they implement, probably during this next year. Chris, I'll turn it back over to you. Oh, Ann, I see you have a question. I'm sorry, Ann.
Go ahead.
So, Ann, you may be on mute.
Oh, thanks. Yeah, I couldn't unmute it. Wouldn't let me. So this question I was going to wait maybe to ask it later, but you kind of went through some of the stuff with the different vendors, like the difference between what the vendors are going to do, how they're going to implement versus the standard. So if it's at a state level, I know the hospital system would send back the linked data, and so we would get the UUID that way into our trauma registry, and then they would also send it on to NTDB. So NTDB would get it. But if the state has an EMS registry with one of the vendors and they have a trauma registry with a different vendor, is there been discussions, or how would those hospitals that have if they have their own separate vendor, how would they get those EPCR records available to them to do the linkage within their trauma system?
Yeah. So, and I think I think your question speaks a little bit to what kind of Josh was talking about, right? If you're right, if you're using, the same software company for your state EMS data collection and your hospital registries, right? Then there's clearly, some synergy there, right? And perhaps they've really made it efficient to be able to move that UUID across from the EMS record to the
I don't want to put you, I just realized I might have put you in an awkward position. I don't want you to, I just am curious, like, if these conversations have occurred with the vendors, and because I think that there are going to be states that have separate vendors. And I just want to find out, I guess, does that mean that those hospitals just won't be able to do that linkage and that's just how it goes? Or do you think the vendors are committed to being able to work together with this? I know you don't want to make any recommendations, but
I know, it's a great question, and our sense is that the different softwares will work together to make sure that this is true and works for everyone, regardless of what software they have on either side.
Okay, great, thank you.
Yeah, and great question. All right, Chris, I'll turn it back over to you. Thank you so much for folks joining.
Yeah, awesome. Thank you. And thanks for all the great conversation, the information here. This session has been recorded so that it will be available on our YouTube channel and on the website shortly. If you want to be notified about events like this and others that are important to the NEMSIS stakeholders, please go to the NEMSIS website at nemsis.org. In the upper right-hand corner, you'll have a button that says Join the Google group, and you can enter your email there. We will get you onto the mailing list, so when we're making announcements for these types of trainings and the V3 calls. Also, if you have an opportunity, head to your to Facebook, Twitter, X, or LinkedIn, and also YouTube, and you can subscribe to the NEMSIS TAC from there for more and fun information that we are putting out all the time. With that, thank you everyone for your participation, and I hope you have a great rest of your day.